Well, joining me now to take the pulse of the dueling healthcare policies and how our city might be affected depending on the legislative outcome are Mark Haney, the director of the Metro New York Healthcare for All campaign. Welcome, sir.
Thank you. Also
want to welcome Bryony Romer, a healthcare activist with Get Organized BK. Thank you for being here.
Thank you.
And Afia Ata-Mensah is the executive director of Community Voices Heard, an activist organization focused on women of color and low-income families. Thank you for being here as well.
Thank you.
So everyone's talking about this, whether it's the water cooler or the halls of power in all of our representative bodies. But before we go forward, can you just look back with me for a second at what was Obamacare, as it's popularly known? And I wondered if you see room for improvement there before scrapping it for whatever plan that the GOP purports to have. You want to start, Mark?
Well, I think it's important to understand that the Affordable Care Act is not in a was situation. It's still in an is situation. It is still the law. It is still in effect. Nothing has changed. All that's happened is the House has passed a bill which they developed to supposedly repeal and replace that, along with making very dramatic changes to the Medicaid program, which hasn't gotten so much coverage in the media, but is a much more fundamental program for millions of Americans, many more than just the Affordable Care Act per se.
So, Afia, from your perspective and the population that you work intimately with, where were the holes, or currently, where are they in what is the law of the land with the ACA?
Well, listen, I think we should first start by just applauding the Affordable Care Act, right, for bringing to attention a much-needed issue, right? The idea that you had families having to make hard choices about whether or not to pay rent, to buy food, to buy diapers, or to buy medication, where and how they would get care for mental health services. So, yes, there were areas that needed to be improved. For certain families, you know, the deductible was higher. It was difficult to find exchanges in other states, but that should have been something that was approved upon, as opposed to what we had go on in the House, where they've tried to move on, you know, changing the Affordable Care Act by eradicating health care, or moving to try to eradicate health care for millions of families, and having what could have devastating impact for New Yorkers across the state, but particularly for low-income women of color in New York City.
So, Bryony, Afia touched on the exchange. Is that going to go the way of the dodo, do you think, if this plan goes through?
I mean, I can tell you that the activists that I work with are really scared of that. I work with a group of grassroots activists who have gotten involved in this fight, many of them for very personal reasons. That, you know, we have members of our group who, we have one member who's relies on Medicaid for essential services to get around. We have another man who says flat out the ACA saved his life. It enabled him to be treated for cancer that otherwise would have gone untreated. So I think there's tremendous personally driven activist momentum to stop it, and I think we're out here leveraging as much participation as we can to put pressure in the right places to stop the efforts to repeal this.
So, Mark, looking at this activist community that seems to be growing, people become accidental activists when you start to mess with their health care. I wondered, looking at the numbers, how many people are really under the threat of losing any form of insurance here?
Well, under the first version of the bill that was analyzed by the Congressional Budget Office, the estimate was that 24 million Americans would lose their coverage over a 10-year period, 14 million in the first year, whenever the new law, should it take effect, would go in place. The governor's office here in New York has estimated that about 2.7 million New Yorkers are at risk at losing their coverage under the House bill. Now, they made some changes to the bill before the final version got passed last week. So we're now waiting for a new analysis from the Congressional Budget Office. Those numbers may go up slightly because of what the changes that they made.
So when you're looking at 14 million, 24, as startling as all those numbers are, you know, I have a sort of a thing for the hometown, but 2.7 million, nearly 3 million people are at the threat of losing their insurance coverage. I wonder what the feeling is on the street now. Is this something that people are cognizant of? Because so often it seems like far away, like this Washington talk. But are you getting a real sense of people being worried?
Yes, and I mean, listen, people will continue to get sick, right? So it's not as if the care will be taken away and that means magically folks won't get sick. They'll still get sick. They'll still require care. It's going to put an added burden on our healthcare system here in our hospitals in New York City. And people are clear that this is going to have a real detrimental impact to themselves and their families. And what is really kind of, I think, interesting for us in this activist community as we're building a movement to make sure that there's intersectional analysis, right, of what it is that healthcare affects housing, right? That housing, lack of access to safe housing inflames medical conditions and vice versa, and that we have to kind of build together in this to make sure that we have a full frontal resistance on these attacks of the Trump administration.
Well, I don't think you can have any intersection without talking about fully half of the population. I'm referring to women, of course, and how this plan seems to have a really detrimental effect to them when you factor in all of these notions of pre-existing conditions and what women's care actually is. So flesh that out for me. You're with Get Organized. What are women doing?
Well, our women's healthcare group has actually been very active on that and has come together with us on some demonstrations. You know, I mean, I think actually there's a provision related to women's health that's really important to know about in this bill for New York State, which is that the bill forbids using the tax credits under the bill for any plans that provide abortion coverage. New York State is a very pro-choice state and has regulations that requires insurance companies, insurance packages to include abortion services. So as Representative Dan Donovan from Staten Island pointed out, the tax credits under this legislation are actually unusable in all of New York State under current law because there's a provision to provide, because we believe in choice in the state. Beyond that, I mean, I think the list of pre-existing conditions that are potentially penalized under this bill is long. It includes trauma, domestic violence. There's a history of insurance companies denying coverage for those reasons, and those could go back into effect under this law. So I think that women pay a particularly heavy burden. I think also the chance that you know, the certainty that women would be asked to pay more for insurance, for pregnancy coverage, for other things, which obviously are part of our life cycle.
Yeah.
And of course, the bill also includes a provision that guts all federal funding for Planned Parenthood.
Yeah, of course.
And 96% of the funding that Planned Parenthood gets goes for services that are not related to abortion services. It's all kinds of primary care and women's health services.
Yes,
and the
in
other
many
thing, the other thing just to mention is that Representative Donovan also represents parts of Southwest Brooklyn. So.
You were saying something?
Oh, I was just going to say that in many communities, Planned Parenthood is one of the main health care providers. So that provision alone threatens to remove care from a large segment of the population.
So who's going to feel the impact of this proposed plan if it were to become the law? Who's going to feel it first and hardest?
Well, I dare say everybody in some way, shape, or fashion.
Yeah.
Even there's some analysis that's been coming out just within the last week that people weren't aware of, that there are provisions of the law around this loosening of standards around pre-existing conditions that could affect all kinds of insurance, not just public programs like Medicaid and the Affordable Care Act, but employer-sponsored coverage, which is how the vast majority of Americans get their health insurance. So we've all got a stake in this fight.
I was just going to say, I think the people who will be hurt the most are anyone who's older and sicker, or anyone who might someday get older and sicker.
Well, God willing for the first.
Right.
But I mean, really, I think they've designed this in a way to try to kind of separate us from each other, to say that, you know, healthier and younger people should maybe pay less, older and sicker people should pay more. The reality is we're all getting older. We'll all be older someday, and you know, chances are, in one way or another, all of us will have a health situation that needs treatment. So,
and on the flip side of that, the people who will win under this law are not just the younger and healthier, but also the wealthier.
Yeah.
The top 2% of taxpayers are getting a
some people say
huge
it's tantamount to a tax break. Yeah.
cut under this law because they were the ones that have been helping to pay for it all along.
And what you have really is a proposed bill where it's seeking to harm, I would say, as everyone agrees, a little bit of everyone, particularly low-income people,
Yes.
right? And really what this bill also amounts to is a massive transfer of wealth, right? We have a massive transfer of wealth to some of the 1%, for lack of a better term, right? On the backs, frankly, of, I would say, women, I would say low-income folks, and older people. And there has to be a real conversation, I think, a pushback on the moral compass of folks who are voting for a bill that is going to penalize people for being low income, having the nerve to grow old, and for being sick.
Right, and also children,
Yes.
because when you look at the Medicaid program, it covers an awful lot of children in New York.
So looking at this broader landscape and knowing how just trash we are compared to the rest of the developed world and providing for the care for our people, how do you guys think we should shift the narrative to take healthcare out of what seems to be now this realm of people thinking it's an entitlement, that government providing for the care and viability of its citizens is an entitlement program? What work needs to be done to shift that paradigm?
Well, I don't know if I'd want to shift that paradigm, quite frankly. I think all of us in the health activist movement and advocacy movement fundamentally believe that healthcare is a human right, and it's the government's responsibility to make sure that that right is realized in some way, shape, or fashion. As you indicated, every other advanced country has figured out how to do it. It is not rocket science. No two do it exactly the same, but there are models out there that we can look at. They all cover all their people for a whole lot less money, and they have much better health indicators than we do.
Well, to be clear, when I'm saying entitlement, I'm not saying handout. I'm saying that it is an inalienable right in some perspectives. So it seems in this country, we do make it seem like the least of them, like they're sucking off of the rest of us who are paying in. So what work can we do in getting organized and being vocal about it to say this isn't a handout, this is something that should be a right of you as a citizen?
No, to your point, I mean, the term entitlement has been, become negative. It should be the narrative shift to a right, right? With a full conversation and understanding that the framing of entitlement preys upon certain dog whistles, right? Those people who don't do anything are getting health care. Those folks are going to be, lapping up all the good medications, and a real narrative change to by the grace of God, if your mother gets sick tomorrow, right? Do you want to have to make those decisions about, do I pay the rent or do I pay for prescription drugs? With so many of our young folks dealing with issues of depression and anxiety, right? And families who are really going to be devastated if they're losing the ability to have their children on their health insurance while folks are coming out of school. What does that look like? Right, for a young person who's working in the city, trying to pay the rent and figuring out whether or not they get the prescription medications that literally keep them safe. Those types of narrative shift questions, I think, really change the dynamic and force us to have some uncomfortable conversations about why people were okay that certain folks didn't get health care.
Yeah, and let's acknowledge that race is a big, big factor in this.
What I see happening is a real groundswell of support for proposals like Medicare for All, that proposals that promise to provide universal health coverage for our citizens. There's been tremendous activism around the New York Health Act, a proposal that's currently in the New York State Senate. It's being held up by the Republicans and has gained tremendous support over the last few months. There's a bill in Congress moving through Congress for universal health care also, and I think that these efforts by the Republicans to try to take away the admittedly imperfect system of Obamacare and remove coverage from people is going to make people realize that another solution is possible and move in that direction. And people like Warren Buffett are in favor of it. People like Warren Buffett's Republican business partner say that it's the way to go for business.
Been making the rounds.
And Bernie Sanders will be putting out his own bill by the end of this month in the Senate.
So in our last moment, I'm going to ask each of you to divide that up for me and say something that we can do right at this moment to resist what many see as a bad thing coming, and to gird ourselves in case it actually does. If there's some practical measures we can take, whether stockpiling your birth control, or like whatever you can see that might be helpful to resist and prepare. You want to start, Afia?
Sure. I think this is a great time for us to be pushing our state elected officials for what's the protection for New York State, right? New York can be a leader. We can't just talk progressive. This is a chance for us to really kind of show and earn our progressive bona fides on what could a single-payer system look like in New York State. What does that mean? What does that look like? And I would say what folks should do immediately is to make sure to follow groups like Get Organized, BK, and Community Voices Heard, so that they can hear first time on the ground when we need to organize and to make their voices heard, because it has made a sizable difference when people are pushing these town halls and really holding folks accountable for how their votes affect their lives.
Gotcha. Bryony?
Yeah, I mean, I would say get involved, show up in every way that you can, whether that's coming out to a demonstration, whether that's calling your representative, super important, both on the state level for things like the New York Health Act and nationally. And then also super important, tell your healthcare stories, because our legislators, our Democratic legislators, if people have friends in Republican districts, they need to know the impact of this bill. They need to know the positive impact of the ACA and Obamacare. They need to know what people stand to lose. And making those stories heard is critical.
Mark, take us
And I would
home.
just say that the fight now is finished for the time being in the House. It's shifting to the Senate. We need to be focusing on that. We're lucky here in New York. We have 2 senators that are very supportive of the Affordable Care Act and of the Medicaid program. I was with an event with Senator Gillibrand on Sunday, and her main message to everybody was keep up all this activism and civic engagement. Call her office, share your stories with her, show up at events. That is what's really going to provide the fodder that they need as they go into just debate over whatever bill now emerges in the Senate, which is likely to be substantially different than what the House passed.
And just before we get out of here, I wonder, this is my cheat question. Do you think that it's going to get drawn out in the House? Because by some predictions, they're like, oh, they're going to just keep this thing and churn it until the next election, or like just predictions, I guess, in the spirit of Mr. McLaughlin.
Well, I think that's our hope.
Yeah.
Whether that will happen, I don't know. The Senate and Republicans in general are very anxious to do major tax reform and major tax cuts. And in order to do that, they need the money from healthcare programs to do it. So that's an incentive for them to move more quickly. So we're going to have to keep our eye on all that.
Political theater?
I will also say that I don't know. I'm going to take a hard pass, because everything that I thought would be right has turned up wrong. So I just stay ready.
I distinctly remember that feeling going back to sometime late in November. Yes. Bryony?
I don't know. I'm worried that they may move fast, and I think that I think activists and people who want to watch this should not sit back, that we need to keep up the pressure no matter what timeline they take.
Okay, so should any of those predictions come back, we'll ask you about it on future episodes, but you guys definitely should come back.
Well, thank you. Thank you for having us.
Yeah, it was
Thank you for
wonderful.
being here for the conversation.